Somaliland Minister of Health, represented by the director of the ministry, said the Somaliland government is commemorating with a award due to the effect of the mental health in the country, and the government has proposed mental health law in order to care for more of the victims aside from all the programs the ministry has been doing for them before. Joining the ward in commemorating World Mental Health Day, the director of the ministry, Mohammed Abdi Harkey, emphasized that the program was significant to Somaliland as the nation is one of the countries that mental health is a major problem. He said the event, which has a theme as mental health for all, greater investment, greater access, was needful to advocate and speak against discrimination to improve the mental health situation in the country, adding that a budget is set aside for the procurement of drugs for the patient.
Minister of Health and overall the government of the Somaliland, they have doing a lot in terms of improve the mental health situation in the country. There is a budget for some hospitals that has been contributed from the Minister of the Finance through the Minister of Health.
The program, which took place at Mansour Hotel, Hargeisa, has speakers from diverse backgrounds with submission that attention must be given to the care of the mentally derailed in the society. Hamda Abdel Nasser Mohammed, who is the representative of humanity and inclusion in Somaliland, explained that partnership with other stakeholders, both locally and internationally, to support the emotional activities such as these is key, as well as providing support and referring them to mental hospitals. She also emphasized the role of counseling and creating awareness on drug abuse, which is the major cause of mental disorders, adding that giving psychological first aid, solving social problems, unemployment and banning cat consumption could go a long way in reducing the case in the country.
As humanity and inclusion, we do different activities of mental health, like referring the people with mental health to mental hospitals, and also giving psychosocial support to their families, like giving individual and group counseling to the caregivers of mental health people, and also we do psychological first aid to MCH staffs, all healthcare staffs, doctors, and also the community leaders, so that they can take an action if any emergency case, psychological case comes.
Mrs. Adna Ismail of Mental Department of Somaliland Ministry of Health expressed the ministry effort in curbing mental health problems in Somaliland, taking cognizance of this COVID-19 period, which is a global challenge to the world at large.
Mental health impact of COVID-19 is on many lines. One of them includes people that previously didn't suffer with mental health are now experiencing mental health because of the challenges from COVID-19, and the impact of COVID-19 is most likely going to be with us for quite a while. So the theme for the Mental Health Day this year is increasing investment, which is critical to maintaining health services and ensuring that the impact of COVID-19 on mental health is reduced greatly.
World Mental Health Day is celebrated globally on the 10th of October every year.